Hello and welcome to WhatKeepsYouAwake.tv. It's time again to dive into the hustles, the hurdles, and the highs that keep small business leaders up at night. I'm your host, David Hooser, and I'm excited to welcome today's guest, Dr. Eric Bloom. Eric is an accomplished entrepreneur and practicing physical therapist. His practice combines preventive medicine, or you might say a wellness component, to his traditional physical therapy services. He also is a part of the faculty at Tufts University Doctor of Physical Therapy program. It's a mouthful.
Yeah.
Dr. Bloom, my friend, welcome to the show.
Thank you. I think it's the best introduction I've ever had in my life, so I appreciate it.
I appreciate that. Compliments are always welcome. Let's get started, but I had good material to work from, so you made it easy. Let's get started with our foundational questions today. Sure. So tell me, as an agent of change in your industry, what keeps you awake late at night?
Yeah, I think the biggest thing is knowing that change is inevitable.
Okay.
I think in life, but much less in business. So, I mean, I've been a practitioner for 16 years, business owner for 8, and I don't think there's ever been a single year that's ever been the same.
Yes.
So I think the biggest change really came after what happened with COVID.
Yeah, how do you do physical therapy when you got to have 6 feet away from your clients?
That was very challenging, and thankfully that we were considered, kind of frontline importance with it. Yes. But the biggest change right away was elective surgeries got shut down. That's a big part of our practice. So, ironically, I moved into a building that I own in March of 2020, literally the week that they shut everything down. So instantly, change was happening overnight.
Wow.
So we probably had a 50% reduction for 6 months. And so you're learning, now how do you get into a new building? But then how do you continue a practice and treat people with all these restrictions and things that have never happened before? And it definitely was a unique challenge, and we overcame it. But I think it's one of those things where we had to learn as change was happening, how do you adapt to that? It wasn't a understanding that change is going to occur because we can see something coming in the next 6 months or a year. This was a overnight change, and we all had to figure out how to adjust to it.
Right, and you can't go remote on physical therapy services.
No.
You have to physically connect with your clients.
And it's interesting because they turned telemedicine into a bigger market for physical therapy, and I think early on it was just allowing clients to retain that face-to-face communication, but quickly we realized that can only happen for certain people. You needed that one-on-one interaction, the things that we went to school for and the training that we can do that you can't do from afar. So there's still a place for it. I think it's more of on that maintenance side when they're done, and that's kind of how the whole wellness thing came about too. Right. But you can't really adapt to that change without having somebody working on them directly in your clinic. So we've made all kind of changes, and sometimes it was whatever the state or kind of nationally was doing that we had to do, and kind of learn how to adapt pretty quickly.
OSHA, you have all kinds of agencies with input over how you engage with your clients.
Yeah, and not only that, you had different people that had different beliefs on what was going on too. So you now had to adapt to the change of, you might have 2 people in the clinic that can believe completely different things about what was going on, which outside of COVID, that's always happening too, because you got different dynamics of individuals. So that was a little bit of a unique challenge, but if you weren't ready for that change in business, then I don't know if you'll ever be ready for change.
For a business itself, because it's going to, that came out of the blue, but how many other things come out of the blue? That
was a medical issue that kind of came out of nowhere, but there's constant things like landlord issues potentially where, oh, hey, by the way, we're needing you to get out in 60 days, or something happens to one of your employees and then they're gone in a week because they got to move somewhere else. So change is inevitable. And then I think the people that struggle in business or just in life sometimes just don't know how to adapt to change.
Can't address
it's going to happen, whether you like it or not. So you got to figure out how to make it as easy of a transition as possible.
So how'd you get started? You said you've been practicing for how many years now?
Yeah, I'm in my 16th year right now.
16th, but you didn't start as a business owner. You started working for another company?
So in undergrad, I actually was a marketing major because I liked that dynamic to it. And then when I started taking classes the first year, I got bored out of my mind and realized that's not my personality. But I was a basketball player in college too. And so I was had some injuries where PT was part of that. And so I knew my longevity in the profession of basketball was not going to be forever. And so I changed to the PT route to figure out, like, how can I still stay active and involved with whether it's sports or something active in healthcare. And so I immediately changed. But there's always been that kind of entrepreneurial marketing aspect that I wanted. And going into PT school just allowed me to kind of merge those two at some point down the road.
Okay. But so you did about 8 years of working, learning the trade through corporate America, we'll say.
Yeah, most of mine were all small businesses. Okay. So I worked for a couple of years here in Arizona and then moved to Georgia to do a specialized orthopedic training program. That's where I started to get into teaching there a little bit. Came back, did some more work for a few years, got promoted to a director of a clinic. I wanted to understand how things ran. I think nowadays, especially teaching at a university, I think there's a lot of misunderstanding of what it takes to actually run a business, much less a medical practice.
Right.
So I didn't want to go in and have inexperience in business and inexperience in the profession. So I wanted to understand how to run things first before I try to take that leap on my own.
Okay, makes sense. But, I mean, you also need a team. I mean, whether that team is directly working for you or indirectly through a contract relationship.
Absolutely.
That's the one thing I stress with entrepreneurs, aspiring new, startup is you don't necessarily have to bring 20 people into your company, but you do need the skill sets for finance, for marketing, as you pointed out, for operations, for a variety of things that impact or that make the difference in whether you succeed or not in the early years.
Definitely.
Which are the hardest. So
my thought process is if I went to school for my specific industry, what makes me think that I'm going to be a great marketer or great in business or something else with it?
HR person.
Absolutely. So I'd rather hire people smarter than me that are good at those areas, because then that's what brings a team together versus me expecting I can do it all. Now, early on, you may not have the resources to do that.
Right.
So you learn to figure out how to become multiple hats at one time. But as you grow, or if you want to grow, you can't be all of those. There's just no way it's going to work.
Right. So then, so about 8 years ago, you went out on your own.
Yeah, it was a group that I kind of joined that was small. And then within a year, they decided they wanted to go sell, and some were trying to retire. Some wanted to go a different route. So 2 of them went to a kind of a bigger corporate component. 1 went to a local growing company. And I said, I'm going to go independent. And so I've been independent for 7 of those 8 years. And really, I was independent that first year. We just had a group of us owners that kind of came together for, more power per se in the industry. But
like a consortium for buying or.
Absolutely. Contracts were a little bit better, things like that. Right. But I think year 1, I was too naive to know what I was doing. Year 2, I was like, okay, I know I have no clue what I'm doing. And then year 3 was like, okay, I got this under control. And then that's when, as year 3 ended, is when COVID hit. So right as you're getting momentum, COVID hits, and now it's like, you feel like you're starting from scratch.
So, and in general, you're working with a lot of what you're doing. There's some cash pay, I'm sure, but a lot of it is insurance pay.
Absolutely, yeah.
And so there's a cash flow issue right there, you can imagine.
Yeah, so your cash flow is trying to get reimbursed what you should from an insurance company.
Right.
And then if people have outstanding bills, and so there's a known dynamic in the industry that you're never going to collect 100% of what you deserve if you're going with insurance. And now you're fighting different battles to figure out how to get that pay and with that cash flow. And I think that's the number one issue that most business owners don't realize or struggle with, is how do you manage that cash flow with things that you can't control. Right. So we talk about what keeps you up at night is how do you handle and manage things that are out of your control.
Right.
And that happens all the time in business. And so those are the things that's, if you make your own issues in business, which everyone's going to, okay, how do you adapt and adjust? But things like COVID, other things like, building issues, what do you do when you've got absolutely zero control and it immediately impacts your business? How do you handle that change? And that was, I think, the hardest one to figure out early with only 3 years of ownership experience, and then COVID hits. It was not quite what I was anticipating.
Sure. So how big is your practice now?
So right now we've got 3 providers, including myself, some other support staff. So we're about 7 to 8 people. That's kind of been the largest we have. Things are kind of changing all the time, but that's where right now. I am in East Mesa.
East Mesa.
Yeah.
Okay.
So it's great development. There's a lot of growth in that area.
Sure.
But there's also an under shortage right now of medical providers. I mean, the burnout's real. I think people are struggling with it. So I'm just trying to figure out how do you adapt with all of those changes too, because, me at 16 years is different than a new grad coming out of school.
Right. And then what's your client demographic? What do you
We see a pretty broad range. Being in Arizona, you're always going to get, that quote unquote snowbird population at some point. But my clinic's a little bit more of a gym style setup.
Okay.
So we get a lot of younger local athletes plus workers. Then you get the snowbird influx depending on where they're at. I mean, in Mesa, there's a ton of 55 and older communities within probably 3 miles of us.
Right.
But usually we're a little bit more on the active side. So active orthopedic sports injuries, whether it's preventative or kind of post-op work, that's kind of who we're seeing.
I did some, because I was a runner for so many years.
So I'm sure you never got hurt.
Oh, my God. Well, and I played a lot of different sports, did a lot of things. But, now I'm in my 60s. In my mid-50s, my back started telling me how I did everything wrong when I was younger.
It's amazing how that works.
And the one thing that got me is that helped is called needling.
Yeah.
You guys do
Absolutely,
needling?
Yeah. So I was training people how to do dry needling for a while, and they call it dry because there's nothing in the needle.
Right.
So my training's pretty broad with the background. So I'm board certified in orthopedics by trade, but I have a big kind of neuroscience, pain science background. So I look at how to incorporate different interventions into treating somebody, not just a kind of here's specifically what I do. Let's figure out if it's going to work or if it's not going to. So that's a huge part that's growing. So forget how long it's been around in Arizona from a legal standpoint. And really there's a lot of things in medicine that's allowed to be done if there's no direct order saying you can or can't.
Gotcha.
Well, people started to kind of press against the issue because you're now doing, needle involvement. So I was one of the few people that actually presented to the state board in Arizona about how to apply it in Arizona because I got trained in Georgia, which was the first state that legally put into the Practice Act. So I know quite a lot about it and been around for a lot of different things. So it's just like anything. If it's used correctly, it's very powerful. And if not, it can definitely not be as effective.
Well, not effective is one thing, but damaging and harmful is another.
Yeah.
But it was incredible, the things it did for me.
Yeah, it's pretty amazing. And there's the dynamic. So having been in the clinical setting, been exposed to academia, which is a different dynamic. And then there's a lot of research. Like that's the big model of those three coming together. I got to see kind of the benefits, but also limitations of all of them. And then I try to figure out how you actually bring them together to make it more clinically appropriate for somebody when they walk in.
Okay. And then part of your challenge too in your business is you got stubborn clients like me who are supposed to do things on our own, but then we come in for our 1 or 2 or 3 weekly, sessions, and you find out I really haven't been doing my homework.
Yeah.
So
I think I'm a realist with a lot of things. And so, I mean, I've got a busy life with doing businesses and got 2 younger kids. My wife's in healthcare. Yeah. So I think a lot of times we over give things to people. And so I'm kind of blunt and straightforward and realistic with what they can or can't do or what they will or won't do. So there's a dynamic where I think a lot of times in healthcare, people feel like the healthcare is just governing what the individual is supposed to do. And so I don't really work that way. There's got to be a dynamic of you're the one coming to seek my help. So what can I do to help you? Like, what are you willing or want to do? And then what resources do I have available to help you get where you want to go? And so I think that's a different mindset I've changed a lot of is I'm treating you for a reason.
Right.
So what do you want out of me and how can I help with what I'm knowledgeable? Not just, okay, you walk in here, I'm going to tell you everything I want to do. And it may not be something that's actually beneficial for you or even something you want to engage in.
Right. That's a novel thought, trying to do what your customers want.
It's kind of weird how it's so simple, yet it's so effective. And not common in medicine because people go to see somebody and it's like, okay, well, you tell me what's wrong and what do I need to do? And if I tell somebody, they're like, well, I don't want to do that. Well, you can't be like, well, sorry, I got nothing for you. Like, well, then you got to figure out like, okay, what are you willing to do? Like, what do you have access to?
Right.
Let's find something that's going to make sense for you.
So I understand we were talking before, you're an independent facility.
Correct, yeah.
Operation versus a lot of big corporate interaction involvement in that space.
Yeah,
right?
the trend, I think, especially after COVID, because a lot of small companies like myself either couldn't make it just because it was so difficult. So
Right.
they either went from a bigger corporate standpoint, meaning, clinics like mine that have a national presence, or they kind of converted into a hospital-based system. So I don't know how long the little guy is going to last for, but
Right.
I definitely think it's a trend that's going more towards bigger and less towards small business. And I don't even think that's just in healthcare. I think that's in any business nature for some extent. But I think small business is the backbone of America and what we do. So we're trying to kind of fight against the natural trajectory of how
Sure.
healthcare is going as long as we can.
Well, I mean, you see things happening like that with we're having, I think, Amazon Prime days right now.
Yeah.
So you've got Amazon who has really hurt the small retailer.
And what's crazy is this was literally just happened this week. Amazon now has primary care doctors.
Oh my gosh.
So they've got facilities that they can run out of it. So
Okay.
yeah, the trends are changing quite a bit because I think they see the value to healthcare, but then they've got the capital and everything else to make it work where smaller guys may not. So it's a very interesting trend. It really is.
Okay. So what are the impacts are you seeing or expecting in your space from AI or robotics or?
Yeah, so we're seeing some of that right now. And this is kind of outside PT, but there was a procedure I think that was done from a surgical intervention using AI in one country, and the patient was in a different country. It was the first time it's ever happened. Yeah, and they just used like robotic machinery. So that's happening there. And so, I mean, you're talking about the extremes of having a robotic-based surgery being run by a doctor in a foreign country.
Wow.
So in the PT realm, a lot of things are going to more online versions, or we're using AI to our advantage from maybe helping consolidate, different exercise programs or using documentation, things that we can integrate that easier to kind of speed up the time because it's always getting harder.
Sure.
Yeah, that's going to be an interesting dynamic of what AI is going to do for the physical therapy realm.
Now, you mentioned remote. So
yeah.
Now, is that remote one-to-one, or can you now do like clients that have similar struggles, issues?
Yeah,
complaints?
that's a good question. So most, especially for PT and most medical stuff, if it's within the U.S., like you can only practice within your state as a practice act. Now, I can do wellness or training dynamics. That's not considered medical to pretty much anyone in the world if I want to. It's just I can't physically formally do like PT to somebody and call it that, and the way we run it outside of state because I'm not,
licensed.
I'm not licensed in that state. So that's kind of one of those people are trying to growing, and sometimes people are even going away from the PT route specifically and going more towards that industry to help people with that dynamic because people are looking for someone that's knowledgeable instead of finding someone that's just got, maybe a smaller degree or maybe just not as much experience. Some PTs are going in that route and having a cash-based online business where they're becoming someone's personal trainer, health coach, whatever you want to call it, because there's less restrictions.
Right. But, I mean, this challenge you have is, in this case, anyone could be doing things that, because, in my case, I would get up every morning, and it was painful.
Yeah.
And going to physical therapy to help really loosen up my lower back muscle and.
So I know there's some.
But I could see a lot of.
Yeah.
Personal trainer coaches thinking they could do something, but actually hurting the patient more.
That's unfortunately kind of a decent population that we see, where a lot of people know kind of healthy to improvement. They don't quite know the not healthy or injured side, and then that's a different dynamic. But even kind of going back to the AI type stuff, there's some people that are using, specific diagnoses from a doctor or somebody, putting it into a machine, and it's spitting out their plan that they should be doing. So that's how we're seeing some of that in here. So that could be done by anybody. I mean, even some patient can put in there, doctor gave me this dynamic, like what does it tell me to do? And then thinking that that's going to have the same benefit versus kind of an in-person with somebody.
But with AI, any AI, I use ChatGPT often to do an enhanced version of but I find I get a better solution if I don't do a 3 or 4 sentence request, but I actually do a complete document and say, now make this a little better. I get better result. Correct, if I just do a couple as I may miss, it won't address things I miss.
No.
AI doesn't.
And I think the hard part is AI is only implementing what you type and what you put in there.
Yeah, exactly.
You come into my office, it's not seeing you visually watching some of those things that's going to be missed. And so
limping.
Yeah, so I think there's a dynamic where it has value, but it can't be the only thing that we turn to.
It's an enhancement.
And I think it's kind of gone away where people are now getting more back into wanting to see, I think, doctors and, medical providers, where for a while it was kind of like, hey, I want to do as little as I can. Give me what I need. And I think they're starting to see that maybe things aren't quite as good as it used to be.
Right.
So we kind of were going back to old school doc where the docs would come to your house, they would treat everybody,
Right.
then they would go. Well, then it turned into like, what people will kind of call like a medical mill, right? Depending where you go, where they feel like they just churn and burn a little bit. But then now people are like, well, I want to go back to that kind of old school thing where, maybe I actually know my medical person a little bit more and I have better integration. And so we've got to figure out how do we implement the in-person with technology that's advancing. And that's the change that's always having to happen. And so you got to learn how to incorporate those properly, and every person's different. You might want something different than the next person. So we can't expect everybody, same injury, same age, same problem, to have the exact same things that are going to help them.
Sure. Everyone's got a unique body.
Yes, they do.
That you have to practice your serve individuals.
Yeah, and I think with PT, like just the time spent with us right now is what people are wanting. A lot of doctors' office, it's a documented known that like you might get 3 to 7 minutes max with your doctor on an average.
Yeah.
So, people are like, well, I didn't really get to address a whole lot of stuff. And I think with what we can do, we see them more often.
Right.
We get to see them physically. Like that's kind of a trend where some people are like, it was nice just to go see somebody quickly and be done, but I kind of miss like the things that I'm not getting. So it's
personal.
Yeah, everybody has their own little biases of it.
All right. So if someone is, so we usually go through a couple of questions.
Okay.
First is, what keeps you awake?
Yeah.
And then the second one is why take on those sleepless nights?
Yeah.
I
I think the first thing was what keeps you awake is how do you wake up every day knowing that what you do impacts other people that both clinically, but also who trust you and are working for you to support them and their families. I think that's a task that is really hard to understand early on, with having to let people go and, other things that you can't control. Like that first person you have to let go or change, like it hits you in the heart pretty hard for the average person that I think does it for a reason. Bigger companies, people come and go all the time, but when you're small, that one individual makes a pretty big impact.
Family,
So yeah, my wife and I were always, our goal was people over profit. That was kind of one of my mottos for my business. And, I always tell people it's not people and no profit because you can't sustain and function.
That doesn't work either, right?
But we want to figure out like, what can we do to the best of our ability to make sure that when people come, they want to be here, have a good job, and know that they trust what we do to allow them to continue to support their families. So that's definitely a on and off, keep you up at night.
Sure. But so why take it on? Why not just go work for one of the big corporate firms and make a nice salary? And
that's a great question. I think early on, I always had a little bit of that entrepreneurial itch with things, and then I think I just got jaded early on, and what I thought was how everything seemed to be very kind of cookie cutter sometimes, and not even in just PT, just in medical industry, and like what can we do that's different? That if I went somewhere and I didn't like something, like what could I bring to the table that's different, that I know if I'm looking for things like this, there's got to be other people that want the same thing. So we started as a way to kind of fill that entrepreneurial vibe that I wanted to do, but also wanted to bring a different mechanism to healthcare where they're not just clients, like not that you necessarily become friends with your clients and patients that walk in, but there's got to be a dynamic where you get to know them more than just, hey, here's this person coming from this issue, out the door they go. We get cards from people when loved ones are sick or passed away or something like that, which you don't get a lot in a kind of bigger world. And so we're invested in them as a person, not just why they're coming to see us.
Got it. Okay, well, that makes sense. So we're going to cover in another episode a little bit on the preventive side, which I think is critical. Most people, and especially entrepreneurs, because we're busy, just like you with your, you're the first one to get there, the last one to leave.
Yeah.
You've got issues that, you want to focus on, improve on. You got new services you want to launch. How do you take care of yourself?
Yeah.
How do you make sure I don't end up in a situation where I, can't pick up my, my 3-year-old?
Absolutely. And the irony of like the prevention is that's not covered by medicine right now. They would rather spend their time and resources in treating somebody that's sick to keep them in the system than try to prevent them from having that problem.
It's illness-based, right?
It is. So it's a very different dynamic, but someone's got to try to buck the trend and make a difference. And so we've added that, and we'll kind of get into that next time.
Yeah. And in the meantime, we'll give you a chance for a shameless plug, I call it. How do people get a hold of you?
Yeah, so I'm basically at Baseline and Hawes right now. So my primary company is Bloom Performance and Rehab. So that is something you'll still find online. Our kind of sister parent company is called Modern Sports Medicine and Physical Therapy. They're kind of the governing group that oversees about 8 of us kind of small clinics. And so we kind of came together to be able to do more. So we wanted to be small, but bigger in number. And so you can kind of find us underneath both of those. Our phone number, so it's 480-357-6500 to call and come in with you. You usually will get rerouted to the Modern name right now because it's now been long enough where we're kind of slowly making that transition there. But you can find me online. It's bloomperformance.com is our website to kind of check that out and see what we do and kind of find out really more what we're about.
All right. Well, I appreciate you coming down. And everyone
Glad
out
to be
there,
here.
thanks for joining us. And remember to like or subscribe to whatkeepsyouawake.tv. Tell a friend, and we'll see you on a future episode.